Hey everybody, it's Manny again. I'm just coming to you from Orlando, Florida. I have a few minutes before I head off to the airport, and so I wanted to do a quick video on blood pressure, mostly because I've been away trying to get away from the stress in my life, and I can actually feel my own blood pressure going down. But as I head back to New York City, that blood pressure is probably going to go back up. Listen, there's a lot of things that blood pressure does. Number one, it is something that impacts people from a very early age. A lot of times it's estimated that 40 to 50 million adults in the United States have high blood pressure, and a lot of those people don't even know it. And so here's why it's really important to get to your doctor and to understand blood pressure, because it is something that you generally will not feel for years, even decades, before it causes you a problem. High blood pressure is virtually symptomless until it causes real damage with your organs. It can impact everything basically from head to toe. It is one of the leading causes of heart disease, both coronary artery blockages and other forms of heart disease and heart failure. It is a leading cause of kidney failure in this country. It is a leading cause of strokes and cerebrovascular disease. It is a leading cause of blindness. So blood pressure is a major risk factor for just about everything in your body. The great majority, probably about 80% of high blood pressure, is called essential hypertension, which means basically we don't understand a cause and there's no secondary cause. It's just something that people have. It is something that you need to get to your doctor at least once a year just to know what your blood pressure is, because if it's high enough, then it needs to be treated. And there are medical ways to treat high blood pressure, and there are non-medical ways to treat high blood pressure. I'm not going to go so much into medications right now, just to know that there are a lot of different types of medications, and many medications which don't really impact other medications you might take or other organ systems. But I'll leave that between you and your doctor, because I think there's plenty that you can already talk to other people or look up yourself about medications. And I want these videos to be more about the things that you can do besides medications that might help. Number one is exercise. There's no doubt that regular aerobic activity, even 20 or 30 minutes a day, can really change sort of the sponginess, if you will, of the arteries in your body. For lack of a better term, the arteries in your body are not lead pipes. They're dynamic structures. They can dilate, they can constrict, and generally the more you exercise in terms of aerobic activity, the more healthy your arteries are and the more dynamic they can be. Which is important in keeping blood pressure low and keeping blood pressure regulated. So that's number one. The best thing you can do is probably regular exercise, particularly aerobic exercise and resistance exercise. Number two, watching your diet, the salt in your diet in particular. Diets that are really high in salt are going to impact blood pressure in a negative way. So you want to watch out for the salt in your diet and the hidden sources of salt. So a lot of packaged foods, a lot of processed foods, a lot of canned soups, and particularly anything you eat out in restaurants are going to be notorious for having a lot more salt in it, because salt is a part of preservatives. And so you want to be careful about eating whole foods and avoiding the types of packaged and processed stuff. And we could go on and on about the different salt content in your diet, but just suffice it to say that salt and diet is a big component. Number three, probably like I said the other day, stress plays a big role. Again, this is where I've gotten into a lot of sort of mind relaxation techniques, yoga and mindfulness and meditation. I'm trying to learn a lot about myself. I'm certainly no expert in any of that stuff, but I think it's important to try to understand the stress in your life, the psychosocial stressors in your life, and get away from that. So that is something you might think about, how your personal relationships and interpersonal relationships might impact that. All that stuff plays a big role in blood pressure. And so I hope that you guys got something from this. I hope you will comment. As always, let me know where you're watching from. Right now I'm streaming from Orlando, Florida, but I'm on my way back to New York this afternoon. I really needed a few days to bring my kids to Disney and get away from the stress myself. For me, my kids are a big part of relieving stress in my life. Is remembering that my number one commitment is always to them, and so that always helps keep me in the right frame of mind. But I hope you guys got something out of this video, and I hope you'll recognize blood pressure. Just as an aside, what is a normal blood pressure comes up a lot. I think for all adults, any systolic 140 or diastolic 90, so 140 over 90 is the basic sort of target for blood pressure in all comers. But if you have diabetes, if you have heart disease or history of strokes, if you have any kind of kidney disease or kidney failure, those numbers are quite a bit lower. Most of my heart disease patients, the target that we're looking for is consistent numbers less than 130 over 85. Dialysis patients might be even less. 125 over 75 would be a target for a lot of those guys. But talk to your doctor about that stuff, and also understand that blood pressure is very fluid. When people come into my office, a lot of times just being in the doctor makes people nervous, and a lot of times you know, just running to get there or running in general will cause your blood pressure to spike. Certainly any exercise is going to cause your blood pressure to go up normally, so you really have to rest for a few minutes, several minutes, and let your blood pressure sort of come down towards this baseline before you check it. And you want to check it in both arms, and there's you know, reasons why I don't want to extend the video too long. I want to keep it nice and discreet for you guys, but we can talk in the comments. If you have questions about it, please feel free to add your own experiences with blood pressure and any questions that you might have, and I'll try to get to all of them. And as always, I thank you guys so much for watching me. It really means a lot to me when you guys give encouragement that you get something out of this, and as long as you're getting something out of it, I hope to keep doing it for a while. So have a great afternoon, everybody, and I'll come to you again soon. Bye-bye.